Hello and welcome to Members on the Mic with the Troy Chamber of Commerce, where we connect with Troy Chamber members as they give us a glimpse into their companies and share some of the business lessons they've learned along the way. Hi, everyone. I'm Tara Thompson-Cusack, President and CEO of the Troy Chamber of Commerce, and I am joined today by the lovely and amazing co-host and Vice President of the Chamber, Sheila Denstead.
Welcome, everyone.
First and foremost, I'd like to take a moment to thank our presenting sponsor, Trion Solutions. Stay tuned for our very first commercial break where you can learn how you can rely on Trion. Sheila, we've got an amazing show today ahead of us. Why don't you give us a little introduction at who we're meeting with?
Well, I'd absolutely love to. Today, we're meeting with Dr. Karolina Maksimonski. She is a board-certified Pediatric Emergency Medicine Physician and medical doctor of the Troy Pediatric Emergency Department at Children's Hospital of Michigan. That was a lot.
All big words.
All big words, grown-up words. She completed her pediatric residency at Metro Health Medical Center, Case Western Reserve University in Cleveland, Ohio, and her Pediatric Emergency Medicine Fellowship right here at Children's Hospital of Michigan in downtown Detroit. She takes special interest in training education and improving patient quality of care within the emergency department. She's also a very proud mom of two wonderful and energetic children, ages 4 and 6 years old. Dr. Carolina, welcome.
Thank you so much for having me here.
Thanks. Is it okay if I call you Karolina?
Yes,
perfect.
Perfectly fine.
Well, I guess to get things started, can you first tell us a little bit about Children's Hospital of Michigan in Troy? I think a lot of people know it's there because it's a very bright building.
Lego building.
It is. It does look like Legos. It's quite cute. But can you tell us a little bit about the services that is provided right here in Troy?
Yeah, absolutely. So I think it's important to know that Children's Emergency Department or the hospital. Stop.
Yeah, it's okay. Take a breath.
Okay.
Let me lead into it again.
Okay, please.
You're okay with me calling you Karolina?
Yes, perfectly fine.
Perfect. Okay, so I guess to get things started is obviously we see that bright, colorful, amazing building on Big Beaver. But can you tell us a little bit about Children's Hospital of Michigan in Troy? What are the services that are provided there specifically?
Sure. So we are a standalone pediatric emergency department with a number of clinics within the facility as well. So we lead our orthopedic clinic, our hematology oncology clinic. Most of our subspecialists do a day or two of clinic out there. So if any of our patients need subspecialty care, they are able to come to the hospital there. And then again, we are an emergency department as well. I think the big thing to remember is that we are not an inpatient unit. So if any of our patients require prolonged stay beyond 24 hours, they will end up getting transferred to our facility downtown. Mm-hmm. All of our physicians that work in the emergency department and within the hospital there are obviously also physicians that work downtown at Children's. So the same docs that you will see in our emergency department downtown in our trauma bay are the same docs that you will be seeing in the Troy ED. We do have a surgical center as well. So some of our outpatient surgeries, same-day surgeries, we'll be able to perform there. And then, outpatient CT or MRI scheduled, we are able to perform there as well.
Well, and that's really great in itself because, like you said, the physicians, they do have office hours per se at the Troy location. So if you're local more to Oakland County, it's super convenient for you to be able to see your provider.
Absolutely. And, if you have services with Children's in general, DMC, mm-hmm. It's the same medical record. It's the same system. They are able to see all of our notes just because we are essentially the same shared facility. But from a location standpoint, you may have a better it may be more convenient to be seen at Troy.
And great parking.
Yes, absolutely.
I lead with that.
There's a comfort level, too, to know that your doctor that you might be seeing in downtown Detroit could also be in Troy. So it's a cohesiveness and probably something that makes the parents feel a whole lot better when they have to bring their kids in.
Absolutely. And, should your child need transfer downtown, there is a familiarity with all of us. We know the system. We know our colleagues as we work at both locations. And so that transition is seamless and smooth.
Fantastic. Well, I'm very excited that we're finally at summer. I took a bit to get here. Obviously, families are going outdoors a lot more, doing a lot more things, getting a lot more activities. What are you seeing, or will you start seeing as it pertains to injuries, and what can parents do to prevent them? Not that we don't want to see you, but we don't want to see you.
Yeah. I completely understand. Right, absolutely. So, we see injuries and traumas throughout the year, but definitely in the summer, we consider this our trauma season. So anything from bumps and scrapes and bruises to, broken bones, fractures, cuts, lacerations. And then, for better or worse, this is our travel season. So people are out on the road, kids are out of school, they're spending a lot more time outdoors. And so as a result, we are seeing a number of car accidents, peds versus auto accidents, unfortunately. And then people are spending a lot more time around bodies of water, whether it be pools or open bodies of water. There's a component of, again, travel where people maybe are a little less risk averse because they are traveling. And so as a result, they feel they challenge themselves a little more. And so as a result, may not be aware of the challenges or the safety issues that they may encounter.
So I think this is a good moment to take a quick little break and hear a word from our presenting sponsor, Trion Solutions. We'll be right back.
My name is Jenny Brown. I am the CEO of Dutton Farm. We are a nonprofit in the behavioral health system. One of the things that we are so grateful for in our partnership with Trion is the absolutely incredible customer service that anytime we have a question or a concern, we can call up the customer service department and we'll get an immediate and effective answer.
And that's why we rely on Trion.
You can always rely on Trion.
Welcome back to Members on the Mic with the Troy Chamber of Commerce. I'm here with Dr. Karolina Maksimonski with Children's Hospital of Michigan. So we just got done talking a little bit about some of the injuries you're seeing. Obviously, kids are out play, they're out on the roads, they're getting scrapes. Sports are completely, I guess, I wouldn't say prevalent, but nonstop, I would say, in the summer months. What are some proactive behaviors or things that parents could be doing to kind of keep it in check and try to keep their kids safe? What are some ideas?
Sure, absolutely. So, a lot of things are pretty self-explanatory to some degree. Watch your kids, make sure that they're in a safe environment.
That's step one.
But remembering, helmets, whether they're in contact sports, whether they're on a bicycle, on a skateboard, considering things like wrist guards, shin guards, knowing that certain fractures can have a long recovery time. And as great care as you will receive by our emergency department team and our orthopedic team, should you have a fracture, nobody wants to spend their entire summer in a cast. So things that you can do to kind of prevent that. Leading by example as well. Everybody, I know when
we all start laughing at that point.
Right.
We're like,
when I put on my helmet, I always think about, is it going to ruin my hair? But leading by example, especially if you have smaller kids, the kids pick up on absolutely everything that you do. And so making sure that they see you wearing your helmet and being proactive about that as well. I make an effort in the emergency department, especially when I have teens. As far as I'm concerned, the moment that you're handed a pair of keys to a car, I need to speak to you like a responsible adult.
Yeah.
And in that same regard, you should feel as such. So I make sure that I have a conversation with them about wearing a seatbelt every single time they get in the car. I tell them the car doesn't start until your seatbelt is clicked in. To my surprise, or pleasant surprise, I guess, most teenagers are pretty good about wearing their seatbelts. At least that's what they report. And then the other thing that I think is probably even more important in today's day and age is making sure that they're not using their cell phone while they're driving.
Yeah.
Yes.
That text message can wait. That change of song can wait. That email can wait. And again, that's something that we should be modeling for our children in the car.
do you see more car accidents in the summer months than in the winter? Okay, it's funny because most people would think Michigan, it's icy, more accidents. Do you see more in the summer?
Absolutely. I think, unfortunately, people do make the poor decisions of sometimes drinking and driving. People are just in a hurry to get somewhere. They're traveling. So sometimes they're trying to beat traffic. We do see a lot more construction, which may be unexpected for some people on the roads. And then again, kids just being out. So we are seeing a lot of pedestrian versus auto accidents as well. So by far, the summertime is our major trauma season.
Well, and distractions, like you said, is a big factor of it. And I think sometimes we all live in a life where we're so busy that we sometimes forget, hey, there's passengers in your car. And I think some people drive better when there are passengers in their car, but I think it's making sure that we're all being very cognizant of what's going on around us as well.
Absolutely.
And making sure we slow down.
Yeah.
Yeah, that place we're going, we'll be there and we'll get there.
Sorry, I'm late every day.
Yeah.
I am. I know that.
Good for you.
Yeah, I'm honest. I own it. I'm like, well, I'm in traffic for the next 12 hours. I'll see y'all soon. So,
Well, earlier you alluded to it's summer. We talked about that and we talked about pools. Can you talk about water safety? What are some of the things our listeners should be thinking about when it pertains to that for our families?
Absolutely. So if you're a homeowner with a pool, again, remembering that barriers around pools are incredibly important. Yes. So keeping a 4-foot fence, whether your district requires it or not, if it doesn't and you feel passionate about it, it's definitely something that you should advocate for. Just because you don't have a pool doesn't mean that a neighbor down the street doesn't, and it could result in a very serious accident. So barriers is one thing. The other thing to keep in mind is that, most of us, when most people think about drowning, they think about a dramatic flailing of the arms, screaming, and most parents assume that they're going to hear a child drowning. What we need to remember is that drowning is silent. There is usually no vocalization. It can almost look like a jumping up and down play, and it can literally take a minute or two until you have a submersion event that can be pretty devastating. So if you are so first of all, if you're in an open body of water, remembering to swim in areas that are designated for swim only, trying to focus on areas where there is a lifeguard. If you're out on boats or any kind of motorized water sports, wearing a life vest that is approved. And then if you're at a party or if your kids are at a pool, direct, constant supervision, attentive supervision. Unfortunately, most of these submersion events that we see, we will have a parent say that, well, I thought aunt was watching him. I thought grandma was watching them. Grandma will say, I thought that another adult was watching them. So the most important thing to prevent is to have an individual who the people in the pool and the people outside of the pool know that they are the ones responsible for watching the children at that time. This can be silly, but designating them with a red hat. And that way everybody around them knows that individual shouldn't be distracted, that individual shouldn't be engaged in conversation where they're being turning their eyes away from the pool. For kids that are, poor swimmers or children in general, making sure that you are within an arm's reach at all times of those children. Again, because a drowning event or a submersion event really takes a very short period of time. In addition, swim lessons for children over the age of 1 have been shown to significantly improve outcomes in submersion events. And then bystander CPR. If you can take a couple hours out of your day and get CPR certified, anybody on the street can do it. Any child really that is even a teen can take a CPR course. And bystander CPR that is initiated on scene even prior to EMS arrival has shown to significantly improved outcomes in drownings and submersion events.
I think I will constantly have the Bee Gees song Staying Alive in my head doing CPR training. I think that one will never go away.
Yep, absolutely.
Well, it's funny when you bring up those aspects of having one designated person for certain things. My husband and we one time were at a party, and it was easily like 40 people in someone's backyard pool, and a child actually jumped into the hot tub, and no one was paying attention because everyone thought everyone was paying attention, and that was the issue. And my husband was like, that kid's been under a bit, and he went and grabbed him and pulled him out. Literally, the kid was he was turning blue. And it was one of those scenarios where we just assumed, oh, no, but someone knows that this is like he's going to be fine. But it's having the accountable person and saying, hey, can you watch my child? I'm going to go in for a second, or something like that. Making sure someone knows it's their responsibility, I think, is a huge factor.
Absolutely. As I said, most kids drown with a room full of adults around them.
Oh, it's just heartbreaking in itself.
Well, we assign designated drivers when we go out.
Yeah.
Why not have a designated person when we're at a pool? It makes absolute sense to me.
Absolutely. And it doesn't have to be the same person all day long. You can tap out every 30 minutes, but for those 30 minutes, you need to take on the responsibility as an adult that is your sole and only responsibility at that moment.
Fantastic.
Makes perfect sense.
Yeah. Anything else you want to leave our listeners with today? What other nuggets of information do you think they can take? I mean, right now, that's going to sit in my head for the rest of my life.
So, huge proponent of go out there and have fun. We love kids playing outside. We love kids being active, but just keeping in mind to do it mindfully and safely. Sometimes it can just be, again, reiterating with your teen every time they go out, making a contract, even like a pinky swear. That's what I have kids, teenagers do with me at the hospital, that they will not be looking at their cell phone. They will be looking at their seatbelt. We don't think teens are listening. We don't think that kids want to follow rules, but, kids to some degree like to have structure and they like to have rules. And your teenagers are always listening, even if they tell you they're not.
It might be rebellious in some aspects, but they are listening because they do want to feel safe and they do want to feel cared for.
Absolutely.
Well, guys, that's all we have here today at Members on the Mic with the Troy Chamber of Commerce. Special thanks to Dr. Karolina Maksimonski from Children's Hospital of Michigan. If you have any questions or information and looking for new fun events at the Troy Chamber, go to troychamber.com. Thanks, everyone, and have a great rest of your day.
See you soon.
Bye now.
Thank you.